ladies and gentlemen, good afternoon. Thank you for inviting me to this lecture. This is our new hospital, the biggest hospital in Warsaw. It's above 500 child inside, 500 beds. And we start nearly 2 years ago working in this hospital. 2 years ago, we decided to buy the new CT machine, and we decided that we buy CT with the longest detector. The additional advantage of the new system is the newest generation of detectors and interactive imaging system. And we believe that these systems help us for improve diagnostic and the safety of children by reducing time acquisition, motion artifact, radiation dose, sedation, and contrast media. It turned out the volumetric machine in our hospital, we changed the diagnostic protocols and also made it possible to diagnose children with limited sedation and very fast heart action. Now, I will present our experience in congenital heart disease, respiratory tract disease, urinary, and other clinical problems. Let's begin with the diagnosis collateral no sinus for the 6-year-old girl with the length of the scan less than 16 centimeters. Does it mean for us one rotation of the lamp? Does it mean very short time of acquisition? And in result, we have a very good visualization of sinuses. And still, remember, half-second of time. And what's about radiation? Very low radiation in our hospital, in our new equipment. Next child. And the size of head allowed for the volumetric examination. And I must say that each of our examination, we use the interactive software. We obtain quality of this image very good. We can see the post-traumatic changes, the gap of fracture, and the hematoma close to the brain and close to the fracture. And still, radiation is very low. But in this case, we use, in diagnosis of brain, use 100 kVp because we want to see the clear white-gray differentiation. And of course, this examination is possible without sedation. And next child. Cervical vessels in 7 years to 6 years boys with recurrence noise bleeding. The image was obtained with 1 lamp rotation, CDDI volume 6.5 milligray. It's very low, it's very fast. It does it mean without sedation. And excellent visualization the vessels. Cardiac imaging. Cardiological examination in children with congenital malformation of heart and great vessels are the highest challenge for the equipment. The very fast heart section and the small size of diagnosis versus in children is a difficulty. This is a 2-year girl with congenital heart disease and with clinical suspicion of white Blount-Garland syndrome. And you note that the high rate is 120 beats per minute. And we use 80 kV and volumetric scan, 10 centimeters. Does it mean it's possible? And we have excellent image with too big because we know that the contrast coming to the aorta and pulmonary tract will be different. And we can find found coronary artery going from aorta and pulmonary trunk with very good visualization of vessels, and not only close to the huge vessels, but also in distal portion. And we can recognize the connection between these vessels. And still, very low radiation, 5.8 milligray. Other children with abnormality artery going from the aortic arch. Also, we can find artery going from descending aorta to pulmonum. And 3 beat, and still the very low dose, 2.9 milligray in this examination, and excellent image. What about heart rate? 150. It's very exciting and it's very difficult for diagnostic procedure. 3 months boy, 128 millimeter long scan, of course, for us now, volumetric scan. Before, helical. And perfect visualization on tissue of pulmonum, perfect visualization of abnormal mass in short time, without sedation, without anesthesiology, without next danger for child. And you remember, we always use these interactive ECR 3D systems. The reduced radiation is above 75%. Next child, 6 months with tumor of kidney, free-phase examination. We use in first 2 phase 10 centimeter scan, in next 16 centimeter scan, but still very low radiation, 2.9 milligray, and excellent visualization, the tissue, the urinary tract. Next child with hypertension, with problem in clinical examination, with problem with ultrasound examination. And in this child, we use, as usually, 80 kilovolt, and during this examination, radiation 2 milligray, very low radiation, and excellent visualization, not only tissue of kidney, not only urinary tract, but also the vessel, artery going to the kidney. And why we decide, after a few years experience, not only with Toshiba, finish our IVP exams. We now, in everyday practice, use CT uroscan. More information, the same radiation, like in IVP. This is hydronephrosis and 2 milligray. And we use in each examination with contrast 80 kV. And concluding, I must say I'm sure that our diagnostic images after 1 rotation are perfect. The volumetric scan for imaging neonates and small children is a way to reduce time acquisition, radiation dose, motion artifact, sedation, and contrast media. Thank you for your attention.